This is a question that generates a lot of frustration as far as I'm concerned, because it's absolutely clear that there has been very variable endorsement of these genomic predictors from one country to the other. They are used quite a lot in the United States and in some other countries. And then there are parts of the world, including parts of Europe, where the healthcare system is not in a bad shape, where they are still not being used and not reimbursed by health authorities. And it's very upsetting because, we are today ready to pay for some very expensive drugs, anti-cancer drugs, that sometimes bring very small benefits to patients. And there is a discussion to use a diagnostic test that has been shown to allow the physician not to prescribe a very toxic treatment to a lot of women. Breast cancer is a frequent disease, as you know, and it's usually a disease of women above the age of 50. So there are lots of women who could potentially benefit from these lessons learned in the 3 large studies. And instead of that, we still have to use factors to make these important decisions that are completely suboptimal. Like, for example, Ki-67, which is not very reproducible, and where a cut point for decision to give or not to give chemotherapy has never been validated. So I think it's time that we do some lobbying and that governments understand that this is a progress in the treatment of cancer, a very important one, and it is cost effective. There have been multiple studies showing that it is cost effective. And I personally think that if you select patients for genomic tests at high clinical risk, that's where you will have, of course, an important information. In the low clinical risk patients, in the US, for example, they still do the signatures. I think their benefit there is more questionable. So it is when we have doubts, when we start to think this could be a high risk cancer, that there it's important to be able to order the test at no cost or at little cost for patients. Now, the cost is not dramatically high. We are talking about 2,800 euros, 3,000 euros. When you think that immunotherapy for one patient will cost 120,000 euro, well, I think that you immediately understand the difference.